Us on the show to speak on fertility in Nigeria, focusing on factors that impact women's reproductive health, is a gynecologist and obstetric consultant, Dr. Joe Khalifa. Welcome to the show, sir.
Thank you. Good morning, everyone.
So you're practicing OBGYN in Lagos,
Yes.
Nigeria. Tell us a few things about infertility in Nigeria. What do you think causes most of the infertility we see around?
Do you know fertility is a broad, infertility is a broad subject.
Certainly.
So you have to start from the challenges that the couple faces, the woman and the man also, because you know the infertility could be caused by female problems and male problems. So we have to start by the challenges. The couples faces many challenges. Some of them are financial, and the most important are emotional challenges. Okay, because you know, emotionally, you have the family pushing the couple to get pregnant and have a baby and putting pressure on them. And financially, you know, all the treatments, infertility treatment are very costly these days. So they have to put and spend a lot of money.
So one of the things that is prevalent here is that when we talk about infertility, we talk about women.
No, it's
we
not
don't bother
true.
about men. So,
It's not
for
true.
instance, where a couple is trying to have a child and the woman keeps losing her babies, they just argue that something is wrong with her. Is there a possibility that, there's something wrong with the man and what he's bringing in to form that
Exactly.
baby?
You know, when a woman loses a baby, it's not infertility, it's recurrent pregnancy loss. Okay, so it's another subject completely. And this problem is also caused by, the cause could be due to the female or to the male. But let's talk about infertility now and focus on this subject. The infertility is 50% female causes and 50% male causes. Okay, but the problem is that socially everybody believes that the problem is always with the lady. In fact, the problem, no, most of the times, not most of the times, in 30 to 40% of cases, the problem is with the male. Okay, you know, there are many factors that affect the sperm quality. This could lead to infertility. For example, like lifestyle problems like smoking, alcohol consumption, obesity, infections. All of these can affect the sperm of the male. So this could lead to infertility.
What would you say for, like, there are couples who want like 3, 4 children. After 2 children, they can't get pregnant again. What? I know someone who has actually gone for an infertility test now because she has 2 kids. She wants another one, and she's not getting pregnant. In fact, when she even got pregnant, she lost the baby maybe 1 or 2 months.
Secondary infertility.
Yes, this is what we call secondary infertility. Okay, and we're seeing a lot of secondary infertility these days. This could be due to a lot of causes, mainly lifestyle modifications, lifestyle changes, our diet, our daily behavior of the female and the male also. And like I was talking previously, the male factor also plays a role. You know that the spermatogenesis in males changes every 3 months. So, for example, a male can do a sperm test today and he has a perfect sperm results, and he can do it after 3 months and the sperm is very bad. Really? But yes.
Oh, I didn't know that.
But this can be corrected spontaneously. It depends on the modifications It depends on the modifications, diet, lifestyles. And of course, there are a lot of new now in the market vitamins that could boost the sperm. And even there are vitamins that could boost the quality of the eggs.
I was going to, because of time, I was going to come to the solutions we have for fertility in this country right now. What are the kind of solutions that is being offered on the table for women and men?
Okay. For men, like I said, there are new vitamins in the market that can enhance the sperm quality and the sperm count. Of course, and if there is any infection in the sperm, we can treat it by antibiotics. For females, for example, also because there are many causes for female infertility, I will focus on the ovaries, I will not focus on the uterus, we can talk about it later. Concerning the ovaries, to enhance the quality of the eggs and the maturity of the eggs and everything, also there are vitamins. But what I noticed from my practice here in Nigeria and in some countries also, that infertile women and couples, they don't seek medical advice before they are biologically old. What do I mean by biologically old? I insist on biologically. Biologically old is women above 40-year-old. They are actually young, but biologically the ovaries start to decrease its function.
Okay.
So they don't go to the doctors before they are above 40. And this is a big problem and a big struggle for them and for us, because the quality of the eggs will be very bad, reduced, of course, and the egg count also will be reduced. So we need to boost the thing, okay? So there are vitamins, like I said, and there is something, a new technique, and we are doing it here in Lagos. It's called the ovarian rejuvenation. So we can rejuvenate the tissue of the ovaries and give chance to this ovary to rejuvenate again and produce new eggs and better quality eggs, and increase the chance of this lady to conceive from her own eggs.
Okay, so you've mentioned one of the biggest challenge is that people wait on, because we are a religious society. Many people want to pray and wait on God before they would now consider getting medical attention, and sometimes it might be late, but there's also the cost factor. The reason many people go into the prayer zone is not because, they just want to believe in God. It's because when they go to the hospital, they can't afford the treatments. Exactly. And so they would rather just say, God, do the miracle than me looking for the money. How affordable are these new vitamins, the ovary rejuvenation, the vitamins that would rejuvenate the... How affordable are they?
I started our interview with the financial challenge that the couples might face.
Yeah.
Okay, so they are costly. I'm being frank with you, they are costly. The vitamins are very costly. But this technique is not very costly, the ovarian rejuvenation. Okay. Okay? And just to let you know, this technique is a very new techniques in the world. They are you starting to using it 6 months ago or about 1 year ago.
In Nigeria.
Yes. Already, I'm doing it. Okay. And all the studies are very promising.
What's the success rate like for those listening? Sometimes it's not about money. You're sure that this will work.
There is nothing in medicine 100%, okay? Let us be clear to start with. Okay. And even if any couple present to the IVF, the success rate is maximum 50%, and not more than this, okay? And every couple should know this before starting any treatment. Okay, but this success rate will decrease with age, because age is an important factor.
So at what age do you think a woman or a man should come to see a doctor, especially when they've never given birth before? What age should I start knowing a gynecologist and monitoring my ovaries and all that? Okay,
let me tell you, the definition of infertility is a regular intercourse between the couple for 1 year without conceiving. Okay. So whenever the couple is trying to is having a regular intercourse for 1 year, for more than 12 months without conceiving, they should go and seek medical advice, even if they are young. This is by definition infertility.
So I know of a case because I volunteer for organizations that deal with infertility, and one of the things that I heard was the fact that people, if people that are getting married that matured couples, like you're getting married in your 40s, even right from, don't wait until 1 year. Once, as you're getting married, just go straight to consult your gynecologist to check everything. Do you see people applying that level of knowledge, or you still feel like people tend to wait before they show up?
You're exactly correct what you said. If a couple get married at a matured age above 40, they should directly seek medical advice and do some tests, run some tests, because they don't have time to lose and waste time, okay? So they have to go directly to the doctor.
We might have to bring you back to go in depth into infertility because of time. But many of our Nigerian doctors are leaving the country. Why are you here in Nigeria? What are you doing?
Why are you bringing this new technology to Nigeria?
Not technology. What are you doing here, practicing medicine in Nigeria? They are leaving.
Look, I believe that this country and these people deserve the better medical services.
Okay, you are making money. You are making money.
How
long have you been here?
Around 8 months.
8 months?
Oh.
Yes.
Oh, wow. So you're still new.
But let me tell you something. Yes, I'm here and I'm still practicing abroad, okay?
Okay.
Okay, we are here, a team of medical doctors that comes and go every time there is one of us.
That's true.
Oh,
okay.
So you're visiting?
Yes, we're a group of doctors, Nigerians and expat doctors. We're doing a medical team and we work together.
Oh, wow, that's good. Good to have your. So you're here for a few, and then you'll be going back again very soon.
Yes. I come every month for like 10 days, and then another doctor comes.
Okay, just checking. All right.
And of course, there are our fellow doctors, Nigerians, that work with us.
Oh, certainly.
We're one team.
Oh, great. So finally, fertility. Nima Waike, want to have a final question?
Yeah, reading some
I
comments
know
and
this young, well, she's young, she's in her early 40s, and she's getting married to someone who is in his maybe later 40s.
Okay.
And they want to start IVF. They want to get married next year. They want to start IVF immediately. Do you think that they have a good chance?
Like I told you, after 40, the chances decreases. So she should run some tests. We should know and do a transvaginal scan to know her ovarian reserve and run some blood tests. And accordingly, we can evaluate her case and know her chances of conceiving. Of course, her chances are not very high, but sometimes she needs to take vitamins. Maybe if her ovaries are really not functioning very well, maybe she's a candidate for the ovarian rejuvenation before.
Can you give us food?
Recommend for the husband because she mentioned the couple.
Okay. For the husband, I recommend that he do a spermogram, sperm test, just to see if everything is normal. He can continue his life normally. If it's not normal, we can try to fix it. If he's a smoker, he has to stop. If he drinks alcohol, he has to stop. If he's obese, he has to lose weight.
Sugar.
Diabetes, yes, diabetes, I'm saying. If he's diabetic, he needs to control his diabetes in order to have a good sperm count.
But does sugar decrease the sperm count?
It affects not really the sperm count, it affects the sperm in general, the motility and everything.
Okay, we have to wrap up, unfortunately. We're running out of time, but as I said, we'd like to have you and the other doctors at some point come again, give us some suggestions on this. So you're all the gynecologists, all of you, or different expertise?
No, we are gynecologists, all of us.
All of you are gynecologists?
Yes.
Oh, great. So it's a good time. It would be nice to have people come see you. Thank you so much, sir.
Thank you for having me. Thank you.
That is all we can take on today's show. Hope you learned a few things as we have. Have a great day. We'll see you tomorrow. Bye for now.